So big welcome to everyone who's joined us today for this rather special edition of the Menopause at Work network meetings. And these meetings are designed for workplace professionals who are just interested in creating work environments that are more supportive for people going through menopause. And I'm delighted today to have with me Senators Wendy Askew and Maria Kovacic, who I will introduce soon, but you might like to just give us a little bit of a wave. Thank you so much for joining us today. And these two women were on the committee that looked into the menopause inquiry. For those of you I haven't met, my name's Thea. I've been a workplace wellbeing advisor for over 20 years now and focusing on menopause in the workplace for about the last 4.5 years. And so I was there in the very early days where if you think the discomfort in talking about menopause is high now, goodness me, even 4.5 years ago, I can still remember the first webinar I ran for the Australian Human Resources Institute, that has tens of thousands of members. And guess how many people showed up? I had 2 human resource practitioners from around Australia show up for this topic. So you can imagine my delight where just a few months ago, I was able to give evidence to this federal inquiry into menopause, which has absolutely elevated the importance of this topic. So that's a wonderful thing. It's wonderful. And also this inquiry has been really needed because menopause really has been the missing life stage. The missing life stage from intergenerational conversations between mothers and daughters, the missing life stage in terms of education of health professionals, and also the missing life stage in terms of workplace awareness. So that's why this inquiry has been a wonderful thing. So the way we're going to structure today is I'll just give you a tiny background to the inquiry itself. Then we're going to hear a little bit from Wendy and Maria, what the whole process was like for them. I will just very briefly headline the main recommendations from the report. We'll also drop the report into the chat box for you so you can read that in more detail later. I'll have a few specific questions myself for Maria and Wendy around the workplace recommendations, and then we'll have plenty of time for Q&A you can ask the senators anything that you would like. So let's kick off, and just a little bit of background for those of you who perhaps haven't been following the process. So the inquiry was referred to the Senate Community Affairs Reference Committee, of which Maria and Wendy are members, last year in November. And it was the Green Senator Larissa Waters and Labor Senator Mariel Smith who brought forward this motion. But I also wanted to give a big shout out to Johanna Wicks. I don't know if she's on the line at the moment. If you are, you can give us a little bit of a wave and a smile. And yes, hi, I can see there, Johanna. And she played an incredibly important role doing years of advocacy work before this inquiry, bringing together key players in Australia, bringing menopause to the attention of politicians. And she organised their first parliamentary roundtable in Canberra about a year ago. So thank you for all your behind the scenes work, Johanna, in helping to make this happen. And then the inquiry received 290 submissions, I believe, and 7 public hearings were held around Australia and 1 site visit in Queensland. So I got the senators when they were nice and fresh on the first morning, on the first day of the inquiry in Sydney. So it was great to give evidence there, just sharing what I have learned from working on the ground in this space in workplaces for 4.5-5 years. And then the report was handed down on September the 18th. And that's what we're going to be delving into today. So before we get too far into the recommendations themselves, I'm just going to introduce Wendy and Maria and just have a little bit of an informal chat before we get into the content of the report. So first, I'd love to introduce Wendy. Hi, Wendy. Thanks for squeezing us into your today.
I've just taken my computer off mute, so I'm hoping it won't cause too much disruption.
Wendy sounded funny at the moment. Probably just turn off those so we don't get. So Wendy is a Liberal senator for Tasmania, born and bred in Launceston. I was down in Launceston not long ago, presenting at a women's health event with her, which was great. And she's represented the state of Tasmania for about 5 years now. She's the chief opposition whip in the Senate. And Wendy's been on this particular committee for about a good 5 years now, I think. And I was quite struck by the number of health-related inquiries that she has been part of, addressing things like rare cancers, diabetes, ADHD, NDIS, mental health. So she's got a pretty good overview already, I think, of some of the big health challenges in Australia. And outside Parliament, Wendy actually had quite an extensive career in banking. So thanks for making it, Wendy. And Maria, thanks so much for showing up today. So Maria is the Liberal Senator for New South Wales. She's the Deputy Opposition Whip in the Senate. I love that title. You're a whip. Does that mean you whip people into shape? Is that what you're doing for much of your day?
That's a different meeting.
Yeah. And Maria's been on this particular reference committee for the last 18 months. And amongst a number of other issues, Maria has a particularly strong focus on wanting to help secure economic independence for women. And just in some of the other speeches that you've made, Maria, I know that you have first-hand taste of what it feels like to be financially insecure as a single mum, and even have been in the situation of receiving an eviction notice. So you know what that lived experience feels like. And so you're particularly concerned about anything, including menopause, that might be seeing women being forced out of the workforce before they actually are ready to. And Maria also had a bit of a background in banking, I see, running a ANZ franchise, a mobile lending franchise. So I guess the first thing that struck me about the inquiry when I attended was that the committee was just about all midlife women. And I thought, oh, that's really interesting. This issue might be close to home. But I'd just like to hear from both of you, and maybe I'll start with Maria and then go to Wendy. Have you got anything to say about what was it like on a personal level, hearing about these experiences of, midlife and menopause when, that's kind of quite close to home? Was there anything at all that in particular that stood out for you from a personal level?
Yeah, I think something that struck me was that so many women were seeking information and seeking guidance, particularly from frontline medical professionals around the best way to approach the issues they were having, which is exactly what happened to me, and often being faced with incomplete or inadequate information, or being taken down a pathway that wasn't actually around managing menopause and the menopause symptoms and the impacts. And where often you think, oh, it must just be me, or I mightn't be explaining it properly, or I'm not being clear, or maybe I've picked the wrong practitioner. It seemed to be such a consistent and significant issue, and that was being replicated. As you noted, we went to 7 different hearings around the country. This was a consistent problem across the board, and that really struck me. So, for women in particular who feel like they're going through this alone, the messaging to us was very clear, and that struck me. I wasn't alone, and nor is any woman going through this alone. There are plenty of us who are dealing with this or have dealt with it.
Mm-hmm. Yeah, thank you, Maria. And how about you, Wendy?
So similar to Maria, although I had a different experience. I'm definitely postmenopausal. I'm definitely the oldest on that committee, but I didn't have that experience personally. So for me, it was an interesting lesson to understand the breadth of symptoms that women can experience with menopause. I sort of was always under the impression, you go get a few hot flushes, your period stop, and you move on. But to me, it was a real eye-opener for me personally, which is, I didn't have that conversation with my mum because it was never something that was discussed when I was younger. And the only thing I ever got close to was the hormone replacement therapy side of things. I was sort of advised when I did hit that age, well, you won't be able to have it because your mother's had breast cancer. And that's all I've ever really had that side through the doctors. So the understanding we gained as a committee, I think, going through the months of hearings was that we actually got to understand that there is so many myths and misconceptions and misunderstanding in the community that we really needed to have this national conversation. We really needed to bring it out and shine that light on it so that half the population who will all experience menopause to some degree actually have that awareness and understanding going forward. And it's just that's how vital it is to the community and to Australian women.
So you, I guess, with so many other women, despite your level of education and being quite well resourced, you also weren't very well educated and didn't know much about it, or also had that experience of feeling alone.
Definitely, exactly, alone, but also just I think one of the clear expectations that's come out through the recommendations is we just need to increase the awareness, education and understanding for younger women as well. They sort of learn all about their period starting when they start to menstruate, and then about having children, but then everything just stops. No one talks about what comes next. And I think that's what the beauty of this and events like this are about, that actually making women aware of, what assistance and support and treatments are available.
Yeah. I quite like the few inquiries that I listened to. Also, a nice bit of humour came in, didn't it? Like at times some of the senators were saying, I don't know if there's a conflict of interest, but I'm going through perimenopause at the moment. And I thought, no, I don't think there's a conflict of interest. I think there's a congruence of interest. And if you brain fog and a bit of humour here and there, that was nice to see, keeping it real. The other thing I'm interested to know is you've both been involved in a number of inquiries. Was there anything that stood out to you about this one that was in any way a little bit different or significant? We'll start with Maria.
Yeah, I think the one thing there are a couple of things that stood out for me, and in the Senate, the purpose of the committees is to come to outcomes and understandings. But the formation of this committee in itself was a very good one, in that we all had a very strong focus on the shared outcome in ensuring, as Wendy rightly said, that we're having a national conversation about menopause that we've never had before. So I think the importance of it struck us all, and that was reflected in the evidence that we received. But I think the other thing that was really significant for me was around how many women spoke about the impacts to them and where they actually felt that they were the ones that were to blame. They couldn't cope. They couldn't manage the career. They couldn't manage caring for family and elderly parents. They couldn't manage juggling all of these things. And it must all be their fault because nobody talks about this as being an impact. So it must be them that is actually, just not good enough, strong enough, well enough, or capable enough, which is entirely incorrect. And I think the one thing that jumped out at, Wendy and I have spoken about this, is the statistic in one of those first hearings. It may have been the one that you're in, Thea, around, the average age for a woman to retire is 54. I'm 54 now. I was 53 when I joined the Senate. I don't think I should be retiring just because I'm in menopause. And I think that's what it was, is the significance and the impact, and the fact that this impacts every woman at some point in their life, as Wendy said, in varying ways. But every woman is impacted, and yet the information we have is so unclear and so inconsistent. And that really, really struck me.
Yeah, you're just peaking at your age. This is prime time. Yeah. Anything you would add, Wendy, about?
I totally agree with Maria in the evidence that we heard from so many women, as well as specialists, and pharmaceutical, across the spectrum, the actual need to have that understanding became very obvious. And obviously we go around the country, we hear evidence from lots of people in all of our inquiries, but this one, I think we really, as you said, we were all generally middle-aged or close to women, that sort of age bracket, and we all, I think, learnt something as we went through it. So we all individually learnt something specific to our own situation, but also through that understanding, greater understanding of what was necessary nationally as well. So I think that was the key message, that we all, felt that we've learnt something, whether it's about treatment or whatever for ourselves, or just what that need is in the community.
And how difficult or challenging was it to come to consensus around the recommendations?
It wasn't. There was only one area where we didn't have consensus, and that was in relation to menopause leave. Coalition senators, we held a view that the evidence didn't support leave in itself as being a legislated mechanism. Our position was that that's something that workplaces should negotiate themselves, and also the evidence from both overseas and domestically is that the leave piece potentially could create unintended consequences, stigma, and have impacts to women's career progression. So we wanted to be very careful about that. And instead, we recommended a reference to the Employment and Education Committee for further examination, because the last thing that we would want is, with an intention to do good, is to actually create an additional barrier for women going through perimenopause or menopause that impacts their career and, you know, their financial security in doing so.
Great, and I'll get you to unpack that a little bit more, answer some questions around that. But yeah, and I think you mentioned, Wendy, that actually compared to some other inquiries, you know, there was actually really good consensus with just those one or two difference, which is
definitely, and that's the beauty of the Senate, which is one thing that I love about being a senator, is that collegiality between all sides of Parliament. We work closely together, and you know, our goal in every inquiry is to have a consensus report or as close as. And this has been one of those ones where you sort of walk away feeling like we've actually achieved something that's really positive.
Yeah.
Yeah.
So what I'm going to do now is just very briefly headline the main recommendations. It won't necessarily be in all the exact language, but just to give people online, if they haven't read the report yet, just a little bit of a taster, and then we can dive into some of them in a little bit more detail. But just in terms of the report itself, Melissa, thank you, Melissa, has dropped a copy of the report into the chat box now, but it's easily found Parliament of Australia website, and you just go down the side here and there it says report. And I have to say the report itself is an excellent education document. If you want a 360 degree on menopause itself from, you know, the view of academics, practitioners, and women's lived experience, it's a really great document. Okay, so I've just kind of rearranged some of the recommendations into these kind of key areas, and I'll just speak to them briefly. So there were recommendations about, you know, definitely need more and better research into physical health impacts as well as mental health impacts, and also, you know, trying, because it's not easy, to kind of tease out a little bit also the impact of midlife stressors, which can be kicking in around the same time. Definitely want to know more about the economic impact on women, particularly how does it affect their workforce participation. And, you know, we hear a lot about that on the ground, but there hasn't been a lot of, you know, good research done here in Australia. So I want to see more of that, and also a recommendation that the Workplace Gender Equality Agency recommence collecting data on menopause, which apparently it did in the past. Some nice simple recommendations just relating to general awareness, because that's kind of woefully low, or has been, for women of our generation. So recommendations for a national awareness campaign, and also to include mention of menopause in sex education in schools. Wouldn't that be great? I've been wanting that for ages, because you kind of get told to get your periods, but no one tells you that they actually end. So just to start dropping the word early on, I think it's awesome. Then there were recommendations specifically related to the workplace. And there was one very simple one, which I will highlight shortly, which was simply recommendation that all Australian workplaces consult their employees to develop menopause policies. And just in today's, I'm just using menopause as a catch-all phrase to cover the whole transition. I know, you know, to include perimenopause as well. There are recommendations to look into perhaps tweaking the Fair Work Act to make it easier to request flexible work. I'll show you the specific wording of that later. And also to investigate further the effectiveness and impact of reproductive leave. There were some suggestions about menopause-specific leave, but I think in the end the committee thought if we're going to do anything, let's just make it a broader type of leave. And also research that I referred to in the first column there, that's relevant into the economic impact and collecting better data. Big, strong emphasis on upskilling health professionals, particularly doctors. You know, there's a number of different ways to try and make sure that menopause gets included in their training, and also of allied health professionals, and also increasing the scope of nurses so that they can better support women. There was also recommendations related to menopause hormone therapy, which is very much needed, both in terms of access and affordability, but recommendations relating to addressing the shortages, increasing affordability, which might require reforms to the pharmaceutical benefits scheme. The laws will probably need to be changed for the safer body identical menopause hormone therapy to be cheaper. And that's such an important one. I mean, if we could just get that happening. In the UK, you can get a prescription for a year of menopause hormone therapy for about £20. New Zealand have just had the estrogel made available free, but here in Australia it costs about $80 a month, which is expensive. But then also monitoring of advertising for alternative treatments for menopause. And then it just might not agree with my clustering, but you know, just trying to arrange these and some themes here. but also looking at, when it comes to care for women, reviewing the Medicare benefit scheme, existing items to see if the ones for longer consultations are actually adequate for menopause, or whether in fact we might need a menopause specific item to allow doctors to spend more time, because more time is needed. Recommendations to boost existing ones, or perhaps some more, women's health services have got that multidisciplinary focus, and call for a national action plan on menopause. There are also another 2 recommendations which I haven't written here, and they relate to making sure that we're keeping in line with best practice by tracking what's happening in other jurisdictions or internationally. We know that the UK are quite advanced in this space. So that's just to give you a little bit of a quick snapshot and a quick overview. So I thought, given today's audience, we might just zoom in on the work recommendations. And so I first of all just wanted to highlight how wonderfully simple this one is. Doesn't require any government department to approve anything. And in fact, it's just encouraging workplaces to do something. And I guess I would just, kind of flesh that out a little bit to make sure that those policies are robust. They're not just about e.g. leave, but they're about creating an environment, a physical and psychological environment where it's safe and supportive to talk about menopause and get some simple supports. So I encourage anyone on the line here who perhaps hasn't got anything happening in the workplace yet, you can use this document. You can pull out recommendation number 7 and take that to your boss. So that was really simple, and thank you for that one. Appreciate that one. Then in terms of some of the other work recommendations, and it was interesting during the inquiry, this was the area that had the most difference in opinion, both in terms of the evidence given and perhaps the opinions of the senators. So when it comes to the flexible work that I mentioned before, just for you to see the exact wording of it here, the recommendation is that the government consider amendments to Section 65 of the Fair Work Act to ensure that women can access flexible working arrangements during menopause. So it came through very loud and clear, didn't it? That flexible work is really supportive, really helpful to allow someone to manage their symptoms and their role. So yes, we want it. The question was, is legislation needed here? And if the idea is that if menopause or reproductive health were inserted into the Fair Work Act, then someone who's in a workplace who's perhaps not so supportive might feel a bit like they've got backing. But I will pause here, and I'm just interested in both of your opinions on this one, because yes, in terms of, there's no doubt, I don't think in your minds, that flexible work is a great thing. The question is about legislating and amending the Fair Work Act. Have you got anything you'd like to throw in there, Maria or Wendy?
Sure, I'll sort of just sort of a couple of key points on that are really important. The evidence overwhelmingly throughout the inquiry was around, flexibility in terms of doing your work is critical. And I wrote an article a couple of months ago about, women are retiring at 54. It's not because we're sick. We actually need flexibility in the workplace. The issues are whether or not that Section 55 specifically deals with menopause and perimenopause, and it wasn't clear. And that was part of the reason that we had a recommendation in terms of a reference to employment and education in order to clarify that. So it's not to suggest that you can't use existing leave when we talk about leave, but also whether that flexibility can be embedded into the workplace as well, which is unclear. So, this is something that's really important for us to look at. Do you need to legislate it, or is flexibility already there? Particularly small businesses, they operate with very, significant agility with their employees, and they can, school pickups, school drop-offs, different types of things, and they allow for work to occur at what works for both the employer and the employee. So we need to be very careful that we aren't forcing something that can naturally occur, but we absolutely need to point to something and go, this is another space where we need flexibility.
Add anything, Wendy, there?
I think with Maria's covered it perfectly in regard to the legislative side of it, but the flexibility was very definitely the key message that came through. So it might not be the leave that they need, but they might need to be able to adjust their day slightly and come in a bit later, or, as Maria said, take time to go and pick children up. but also simple things like fans on desks or the type of uniform, the material that it's made out of, does that need to be reviewed? So it's all about the total package of flexibility, and a lot of it is covered under Section 65 of Fair Work Act, but we just felt that our committee did not have that expertise, because we don't actually usually look into that sort of thing. That would be better to have that a fuller look at it by the other committee. So that was sort of our recommendation in our additional notes.
I'm sure it'll be interesting what comes out of that, further investigation. I guess the arguments that I heard, particularly from the unions, about the benefits of legislating is that a person doesn't have to just be lucky to be working for an employer or have a nice manager. They've actually got other grounds, and that has to be weighed up against,
For sure. And I think what you need to be careful about, though, as well, in the context of what the terms of reference are of a particular inquiry, and in terms of this one, is that if you're going to legislate something, then you need to have fully investigated it. And to Wendy's point, there wasn't a full investigation in relation to the impacts of making amendments to Section 65 of the Fair Work Act. And that should be a separate reference to ensure that we don't create any issues, but also to ensure that all the different groups, all the different employer groups, small businesses, larger employers, not just the unions, get a voice in whether or not an amendment is useful or practical.
Absolutely, thank you. So more investigation on that one. It'll be interesting to see what the various departments come up with there. And then the other recommendation, and these were the only two, I think, in the whole report where you had, slightly different opinions. This related to the issue of leave. And it was disappointing that about the only thing that made the media in the reporting of this inquiry was about leave, because it was seen as controversial and all the rest of it. And we didn't get coverage about all the other good stuff that was talked about, i.e. normalising conversations, destigmatising menopause, and putting in place some simple adjustments. However, the unions were very strongly advocating for menopause and or reproductive leave. And you can see here just the wording here. Again, you're recommending that further research be undertaken into the impact and the effectiveness of additional leave. Again, any comments that you would like to make there? And just for the audience, I've just got a couple more questions and then we will open it up. So get any questions or comments ready. But yeah, anything you'd like to add there on the leave issue?
I can be quick before we jump to Wendy, but this is sort of where our additional comments came in relation to the leave recommendations. Again, we don't feel that this is something that necessarily was going to be helpful, I think is probably the best way to describe it. I was trying to pick a better word, but ultimately, we heard from Jen Hales, the Royal Melbourne Women's Hospital, really significant witnesses outside the trade union movement who actually said, hang on a minute, and chief executive women as well, hang on a minute, this might not be quite right. This might not work. There might be problems with this. And these are things that, are very important in our view for us to focus on and go, well, if we're going to create a recommendation, we want to ensure that recommendation is based on a broad spectrum of considered views, and that's what we felt needed to happen more broadly here and didn't. So I think that's sort of my sort of very brief take on that, Wendy, but if you have anything in addition to that, perhaps.
Not really, apart from the fact that, as we've said before, it really is something that our committee doesn't specialise in, and I think that's why we needed to acknowledge that there may be a greater need for further research, which is what the recommendation summarised in the end, that it's further research before we make those sorts of formal recommendation.
Yeah, thank you. Thank you for that. And what I'd also encourage anyone online or any workplaces, because I do know a number of workplaces that do offer leave, I just really encourage you to collect as much data as you can, because we're all wanting to learn about what makes this work or what might interfere with it working as well as hoped. One of the concerns is that, we could offer menopause leave, but people won't take it because they're scared of being stigmatized. There's lots of speculation, so please gather as much data as you possibly can.
Yeah, if I can just jump in there, one piece of evidence, and I can't recall who it came from, that really struck me was someone saying, by providing the leave, instead of opening up and having it as a workplace conversation and workplace adaptation and understanding, you're actually sending the problem away and sending it home. And I thought that was a really good description of what could occur. So, that's sort of one of the ones that, is an example of where people have questioned and not going, you don't deserve to have this. It's what are the impacts of this?
That was actually me, Maria. I said I had mixed feelings. And on the downside, if you send people home, then the workplace doesn't have to change.
So you really struck me, but I just, there was a lot of evidence.
And I'm big on, let's do a root cause analysis. The reason that some women have to take leave is because the terrible neglect of their healthcare. And if we can just get them getting better healthcare, we'll have less women needing to stay home. But I'm glad you remember that one. That's good. Thank you for those extra comments. I'm just going to go back to the last schema so you've got them front and center. And I'm also just going to launch a poll because I'm just interested for those of you online and who are from workplaces, which I know many of you are, what you may or may not be doing in your own workplace. So I've just got a poll there just asking, are you doing anything or some policy or guidelines, adjustments, if you offer resources, and I'll just let that run for a few moments because that's just interesting to know. And what I'm going to do now is just open things up to see if anyone has any questions or comments. And the way we'll do this is if you could use, the hands up button in your toolbar. If you'd like to unmute and ask a question, that would be amazing. Or if you've got a specific question and or comment you'd like us to put into the discussion now, you can use the chat box. And so about half people have answered the poll. I'll just leave that run a little bit longer. And I can see Natasha's raised her hand. So yeah, Natasha, you're welcome to unmute your microphone. You're welcome to turn on your camera, depending how you're feeling today. So I think I might have to.
Sorry, I'm working through my anxiety of being on the camera. So. Yes, I was so excited to see what you've done because in the last 5 years I've also gone through my own perimenopause and also as a physician and also as a coach helped many other women that were going through it. So this was also my kind of cause and my baby that I'm working on here in Melbourne. And also with overseas providers. But what I wanted to comment on two things. One is that I really wonder whether we really should continue using the word menopause when we know it's a process of transition, menopausal transition. Menopause is just one point, one day retrospect of what we've done. And I think it does have, from my experience, and I don't know what others believe, but when you go into workplace and you're trying to talk about things, what's going on, women, even just some women, are having a really negative response. And we know that recent surveys have actually found that older women especially are really not for any menopausal leave. And it's like, I've been through it. It's not so tough. It's not so hard. You can go through it. And also the men. So I'm wondering whether we can actually also change the narrative of how we talk about this and what are we talking about. It's actually a transitional point. It's not just one point in our life. It's a transition. And the second comment that I wanted to say is I love how you've actually put the recommendations forward because it does address this in many different levels, because I think it is 51% of the population is female, and we tend to historically address issues as this is your problem, you need to look after it, you need to go to the doctor, doctors need to know, you need to do this, you need to be physically active, you need to do this, you need to do this, you need to do this. But we are really a part of the whole context, and socially lots of people are having family issues, partners are also suffering. They don't know what to do. Men are 33% of men say we just stay away. We don't know what to do. Only 8% of men are actually saying, well, I've actually asked how I can help. So there is this social support that they need. There is also availability of information. There is a family support, but and then there is also a point in which, what can I do? and how can I be kind to myself, and how can I actually learn a certain skills that I can talk and ask for what I need, talk to other people, talk to even to doctors. I had to convince, I'm a doctor, and I had to convince my own doctor to give me HRT, but also talk to workplaces about what exactly it is that I need, and how does this affect me? Because everything the workplace can do is just a blanket approach, a policy or a strategy, unless we go down and do actually educate individuals of what are the options, what is, how to talk about what affects them, and also educate managers as to how to communicate, how to understand this. We're not going to get far, I think.
Thank you. Thanks, Natasha.
Sorry.
Any comments, Maria or Wendy? And yes, I mean, around the language, the report is very excellent in terms of defining those actual stages more precisely. I was just using my little
yeah, a couple of things. I too have an aversion to the camera, but I think I'm in the wrong job based on that aversion, so I'm getting used to it. I think how we describe it, I think, is important. And I catch myself sometimes too when I'm speaking, because, you know, I'm menopausal, I'm going through menopause, or I'm in menopause. You sort of try and sort of frame it in a way, and I wonder whether that sort of, you know, attaches to part of that stigma. And I've noticed a couple of comments on there, you know, the term itself has a stigma. People don't want to talk about it. People run a mile from it. People don't want to discuss it. I know in my office, mainly, you know, younger people, I've talked about menopause from day one, and I've now normalised it. And, you know, one of my team made the comment that, you know, they now have a better understanding of what their mum is going through. These kinds of things are important in the workplace, because if we talk about it, you know, we have someone's mum, someone's, you know, sister, you know, someone's husband, someone's partner, whatever it is, getting information that we haven't had before. And this is the other piece that came out of this inquiry, is that not just women, but the community more broadly and medical practitioners do not have enough good information at hand to provide women with the tools they need to make effective decisions. So I think it's a reframing of the whole national conversation, as Wendy called it, with a focus on those elements. And I think we've just started this conversation at this level, which is a great thing. And I think it's going to evolve, and we'll work out what the best way to communicate different elements of it will be. But I'm not sure, Wendy, if you have any other thoughts on that.
I just noticed one of the chat messages that came up just said educate, educate, educate. And I really believe that is the solution for the problem, in that if we start young and we actually educate, whether it's the doctors, the other healthcare workers, the nurse practitioners, if everyone actually has that opportunity to have a greater understanding of the whole transition, but also what options are available in regard to treatments and things like that, I think the awareness will grow. But, you know, one of those recommendations is saying started at school, and that was sort of my thing right along. You don't get told anything beyond, you know, yep, your periods will start and then you'll have a baby, but nothing beyond that. And I just think having that full picture in the original education process is where we need to start for the future. But in the meantime, just talking about it, the awareness campaign, if we get a national awareness campaign going, I just think it will, in the end, the conversation will just be normalised within workplaces, as within the home, with friends. I mean, some women won't even talk to their best friend about their symptoms and things. So the more we can actually make it a normal conversation, the better.
Great, thank you. Does anyone else have a question while we've got Wendy and Maria here? Or if you've got a comment you want to make, you know, just keep it precise. Again, you can put your hand up in the chat box, in the on your toolbar. You might like to think about what do these recommendations mean for you personally? What might they mean for you professionally? And is there any way that you can leverage this support in what you want to see happen in your own, you know, environment? Anya, yeah, go for it.
Oh, hi. You're getting me on camera out for a walk while I listen to you, which is fabulous. So thank you, first of all, Thea, for hosting this, and to the senators for this fabulous inquiry. On a positive note, my 16-year-old recently told someone in class to look me up when they said they didn't know what menopause was. So I thought that was quite encouraging. The message is getting through. In terms of the general awareness for, I guess, women, I was wondering if there was any idea of what that might look like, because I know the bowel screening campaign's been really effective. Is there something along those lines that is planned for women? I don't know, as they hit 40, that you kind of get a happy birthday. This is what might be happening to you in the next few years.
I'm happy to go if you like. I mean, I think it's been one of the conversations has been about whether or not they include flyers into things like the bowel screen reminders or breast screen reminders, but also the fact that, you know, even a doctor, when you go into your doctor's, you know, there's the age, they do different checks, and it just needs to be part of the conversation at that point. One of the things that we were amazed at during the course of the inquiry was the fact that in some cases doctors only have up to about 1 hour in their whole training to discuss menopause. So therefore they don't feel comfortable to do it as well. So I think that's part of what the need for education will be. But basically just the opportunities, and the national awareness campaign will no doubt develop something along those lines. But whether it is a national advice or screening, I'm not sure at this point. But I think there's certainly been suggestions such as that along the way.
Thank you.
Yeah, I know in the work that I've done in workplaces in the good old days where most people were in the office, we absolutely found those posters on the back of toilet doors to be one of the most, when we evaluated all the different sources of information, that was hands down what people remembered the most and actually had the most impact. So it's pretty simple stuff we're talking about, isn't it? It's not rocket science. It's just actually doing it. And just on that note, I am making a number of those posters available for free for World Menopause Day, which is coming up on October the 18th. So I'll email you that if you want to start raising some awareness in your own workplace. Thanks, Anya. And I can see Melissa's got a hand up. Melissa Stewart, go for it.
Yes, hi. Thank you for hosting, and thank you, Senators, for being part of this event and conversation. I just wanted to understand a little bit more your perspectives and reservations around the option and recommendation for federally legislated reproductive leave. To me, I mean, any opportunity to have it sort of reinforced in all levels of society and government could only be a good thing in terms of reinforcing positive messaging and having a really strong source of reference for organisations to leverage off of. So yeah, I just wanted to understand a little bit more your perspective and sort of ask to sort of research that option a bit more.
Sure. I think the key thing is the evidence just didn't support it in this inquiry. So that's the reality of our assessment of the evidence before us. I think I mentioned before Jean Howe's for Women's Health, the Royal Women's Hospital Melbourne, Chief Executive Women, and individual organisations and lived experience witnesses. The evidence from those overwhelmingly didn't point to a menopause leave. Some of the concerns were related to an increase in stigma, unintended consequences of, inadvertently making it harder for women in the workplace because of those issues. And also about the fact that we just didn't properly have conversations around that in this inquiry. So our view is that if you want to have a fulsome discussion about something that's going to potentially be legislated, you need to do that properly. So we did, the inquiry itself covered the end-to-end spectrum in terms of menopause impacts across the board, but leave was only a small part of it. So that was our concern. So ultimately, I think what I would like to point to is the fact that there is so much packed into this inquiry that isn't about leave, that is about awareness, that is about education, that is about flexibility, and it is about women having control over their own health choices and having the information to do so. The leave was a very small part that, if it is appropriate at some point down the track, once it's properly investigated, that may be the case. Our view was that that wasn't conducted fulsomely within the bounds of this inquiry. And Wendy, I'm not sure if you have anything that I've perhaps missed there.
I think you've covered it pretty well, but it is something that the recommendations are still for further examination of it. It's not that it's being ruled out altogether, but especially in ours, we believe that it needed to have that further investigation from our additional comments. Yeah.
Thank
Yeah,
you.
it's certainly something I personally love to see legislated at all levels, but yeah, it is something that the University of Melbourne has introduced and in a way that sort of supports sort of discretion and employee consultation. And I'm trying to work on a workplace education piece as well. So I just want to see it everywhere, basically. Yeah.
And as Thea said before, where it is working, that's the evidence that needs to be presented in a further inquiry or investigation into it. So if you have got that, that's stuff that will need to be submitted when there is an inquiry into that.
Thank you so much.
Yeah, and on the poll, you can see that I think 4 people have said in their workplace they do have additional leave for menopause. Feel free to chip in and share your experience on that also. Are there any more questions before we start thinking about the where to from here? But it's great to hear your responses and any queries. Okay, so the report says that the government has 3 months to respond. For those of us who aren't as politically aware and engaged as you are, can you actually tell us, so what happens in that 3 months? Like, how does the next bit work?
The report has been submitted to government and it will then be looked at through the department. They will take it and provide suggestions back to the government as to how the government then responds. So it takes some time for that process to happen. It says 3 months. In often reality, it can be up to 6 months before we'll get an actual written response back. That doesn't mean that things won't change in the meantime. In previous inquiries, we've had announcements that have been made as the budget comes around. They may see that there's a need to implement something sooner. So that doesn't mean that it's being ignored. However, it just means that formal tabling of a final response won't happen until it comes to the Senate after that 3, sometimes 6 months. But that the government will be working with the department on that. And we will just wait for that. We, as opposition, we don't have a lot of say in what comes out of that, but we will be looking forward to reading what the government responds. And hopefully, because it was so uniformly agreed that most of them will probably be accepted, but we just don't know, or noted. They sometimes it will be accepted and implemented, others will be noted, or they would consider further, which is what they may do with the leave because of the recommendation. So we'll wait and see what happens.
Mm-hmm. Mm-hmm. And what's your feeling in terms of which of the recommendations are going to be perhaps implemented sooner or most easily? If we look at the rough clusterings there, have you got any bets on that one? What might just be seen as low-hanging fruit and yet, should be acted on fairly promptly? Can you predict there?
Look, no predictions before I go to Wendy, but I would just say that one of, I think the most important when we talk about is, the educate piece, the information piece, the awareness piece is obviously the awareness campaign. I think if you begin with that, the other information filters from there. That campaign takes, impacts through society, from families to workplaces through to medical practitioners. I think one of the other things that, people have spoken to us about significantly is the access to the MHT and making it affordable and actually making it available. There are shortages. So I think that is something that, there are levers there that can sort of assist with that sort of fairly simply, one would hope. But I would say that those are the sort of couple that you could begin with. But, the workplace piece, the initial recommendation that you started with there for workplaces to actually have an understanding and have these conversations, and that will become, as an outlet from the national awareness campaign as well.
What about
I agree
you?
with Maria. I just agree. I think that's exactly right, the education. But the main thing is that everybody who's listening here today should actually go back to their workplace if it's not already acceptable, and just pull out recommendation 7, as you said earlier, and let's just start the conversation. And I think it's something that, we're seeing it in the community. The fact that you came to Launceston a few weeks ago and we had a brunch with, 200 or so women in the room, all interested in understanding more about menopause and perimenopause. That was, a great and exciting time in Launceston to see that was something that could be achieved and so well received. So thank you for coming for a start, but also it was just a really good indication that the conversation has started and we've just got to keep the momentum going.
And without, sorry, Thea, without wanting to start a rebellion, we could all print out recommendation 7 and put it on the back of toilet doors at our workplaces, perhaps.
Absolutely. There you go. There's your simple takeaway action. Thank you for that, Maria. Awesome. And that was going to be my last question. Is there anything that we can do to help, keep the pressure on for implementing these recommendations? So I've been given the simple one, print out recommendation number 7, take it to your boss, stick it on your toilet. Anything else that can help?
I think ensuring the conversation continues and not just, this happened and we're going to talk about it for a little while and go back to, the normal status quo. I think what's really important is for these conversations to be the beginning, not just something that happened, so that we can push through all the avenues as we've discussed. And, I guess it actually goes the other way. If there's anything that we can do to help create platforms for that or to, amplify messaging, we would love to participate in that. But I think it's something that, we all have to be in order to create that effective change, to be frank.
Yeah, and I've just seen one really good topic that we could keep rattling the cage on, and that relates to MHT. And as Harriet says, Viagra, you can get that on the PBS, can't you? But you can't get menopause hormone therapy. So we can keep shouting about that one.
And you can get it, but it's not necessarily the best for your body. So I think that's the main thing. We just need to be able to make sure that the health minister especially is aware of the fact that there are others out there that may be better suited to individuals and continue to fight for that listing to be done. So I think that's an element of an ongoing process that will evolve over time, but I think it's something that we can still remind our local politicians and especially the health minister about going forward.
Yeah, excellent. So we're coming up just to the hour. We're happy just to hang here for another few minutes until, Wendy and Maria has to go. But I guess just to wrap up, you've heard that recurring theme about really so much of this is about education and awareness. And so, yes, print that out. Please do that. And a reminder that World Menopause Day is on October the 18th. We don't have to limit awareness raising to then, but if you're looking for a hook, that's a great opportunity. And if you want to chat more about some ideas, about that, really happy to talk anytime.
Can I just say thank you, Thea, for organising this. It's been great to actually be able to participate and really appreciate the opportunity to speak to so many women and people who've got great interest in such a wonderful topic. Thank you.
Yeah, that's a pleasure.
Yes, thank you.